HS, also known as acne inversa, is normally a disease which looks like boil initially. So mostly people mistake it as a folliculitis or a recurrent boils, and they do get the treatment for acne or boils. But it becomes chronic, and then once it reaches to the stage of scarring and tunneling, then the patient goes to the doctor's understanding of a disease. So what is very important is to understand that the disease has to be caught up early so that we can manage and treat it well. So disease goes with a 3-stage called Harley 1, 2 and 3, also known as mild, moderate and severe. So most of the cases with mild and moderate setup are the treated, which can be treated from the root, which can be treated very well with the alternative sciences. In medical science, if we see, the disease can be well managed with the help of drugs, which are called anti-inflammatory. They stage right from antimetabolites to biologics to antibiotics, as well as NSAIDs are given to relieve the pain. But in long term, the disease keeps on coming because it has a chronic course, and because of the tunneling, scarring and tightening of the skin, it results into lots of hardship, pain and embarrassment to the patient, and surgery may be required. This is a disease which is caused because of the excess immune responses, inflammatory activities and allergic responses. The people who are predisposed are basically people having a lifestyle diseases or a predisposition, a genetic predisposition for a metabolic syndrome where the lipids are high, blood pressure may be high, they may be overweight or obese, and their predisposition to take a diet which is high in junk, calories, and a non-veg diet, from my holistic point of view, is one of the predisposing factors apart from melange of primary and secondary diagnostic criteria. So what you expect in alternative medicines? Yes, it is a disease which requires a complete case taking, resulting into a minimum therapeutics and a drug picture. And apart from this, we require to make your staging, understand the diagnostic criteria, understand the health biomarkers. Once we do and we match these up, we make a prognosis for the mild case to be from 6 months to 12 months. A moderate case of 6 months to 2 years is enough. A severe case, we can help you to palliate and help your doctors to manage the case well with the help of surgeon, because it is a very severe case where the body is involved and more than 10 areas are involved. That's a very widespread case. So stage 3 is a disease where we don't recommend people to go with. So patient, if in case you suffer from HS, do not get bothered. Better you write to us, let us scientifically stage you, let us understand the clinical primary, secondary and health characteristic, which is called biomarking. Once we biomark your case, we understand what you should expect, and we make a prognosis based upon prognostic, diagnostic and physiological biomarkers. And with the help of holistic homeopathy, we expect you to go with our remission phase very quickly. Maybe it takes a case of mild to moderate, 1 to 2 years of a treatment, and patient actually recovers and changes his personality for the better, because it's a holistic treatment. Unless the personality or the sick person is recovered, the disease cannot be recovered. This is how the holistic approach goes as against the modern medicines. So with the help of treatment, you shall surely recover. I am sure about it. Whether you recover at Dr. Satsangi's or you get a able doctor and you get recovered with the help of alternative sciences, please go ahead with it. Do not get depressed. Do not get worried. This is a disease which can be recovered if caught up early. Stage 1 and stage 2 are the best recipient of treatment at Dr. Satsangi's or with the help of Ayush. This is my opinion, and I'm sure that this information, a little bit of information, will help you to understand the disease very much. Friends, I'm sure that you want to like the information. If you like, please don't forget to subscribe and share with the friends for further dissemination.